My head felt like it was melting, and I was diagnosed with white brain matter damage. We wrote my will. We printed all of my life insurance policies out. We can't breathe from the bills, and we can't breathe because we can't breathe.
COVID-19 is a particularly vicious disease. A significant number of people with COVID show no symptoms at all, but the virus is still extremely deadly and has killed more than 2.5 million people worldwide. In serious cases, people can be hospitalized for weeks or even months. When someone is that sick, they're not thinking about money or whether the doctors saving their lives are covered by their insurance. But when they get out of the hospital, the financial reality sets in.
The day of my discharge was the first time I heard about finance when they said, we'd like to send you home with this medication, and it's $700. And I said, what?
The U.S. healthcare system is notorious for being inconsistent. Americans can get insurance from several different sources, such as from their job, through a government program such as Medicare, or purchased on private health insurance exchanges. These plans can vary dramatically in how much they cost people out of pocket. The variety in the system makes it difficult to pin down exactly how much coronavirus treatment costs in the U.S. because it's different for every person.
Even for people with insurance, affordability is an issue. There is not one access model here in the United States, and so for preventive services, for treatment, it really depends on people's insurance status, where they're located, and the provider network near them.
CNBC spoke with 3 people about their experiences paying for their COVID treatment in the U.S. Here's what they told us. Since the U.S. healthcare system is so inconsistent, it's difficult to collect exact data on treatment costs. But researchers have gotten creative in order to estimate how much patients with private insurance might be paying for coronavirus treatment. Researchers at the Kaiser Family Foundation examined the average cost of treatment for patients hospitalized with pneumonia, and they used that data to estimate how much a person with employer-provided insurance might pay for COVID treatment in a hospital.
When people get pneumonia and are hospitalized, they had to pay about $1,500 out of pocket previously. This doesn't include amounts that they might have been separately billed by their hospital or provider in addition. So like surprise bills aren't included. So we can expect that people will have to pay about that much, about $1,500 for a hospitalization for COVID treatment.
There are many factors that affect how much an individual patient might have to pay. The price can vary based on a person's deductible, which is the amount of money their plan requires they pay out of pocket before their insurance kicks in. It also depends on the patient's copay costs, which is what they have to pay out of pocket for each visit to the doctor. Copayments can vary based on the insurance policy, as well as the doctor the patient is seeing. Some physicians have agreements with an insurance company about how much the service will cost. Those providers are considered in-network, but doctors without a predetermined agreement are known as out-of-network. Out-of-network doctors get a percentage of the costs from the insurance company, but require the patient to pay for the rest. Patients typically get surprise bills when they unknowingly see an out-of-network doctor. Even if researchers can figure out how much a typical hospitalized COVID patient might have paid for their treatment, hospital bills can be just the start for some COVID patients. Some people who come down with coronavirus end up with long-lasting symptoms.
We're really seeing a number of reports of people who report long-term fatigue, difficulties with cognition, with cardiorespiratory fitness. I think what we're going to find out is that a large portion of that is likely to relate to the significant cellular level damage that this virus can cause.
This condition is frequently referred to as post-COVID-19 syndrome. People affected by it tend to refer to themselves as COVID long haulers. Miranda Erlandson and Christina Garcia have suffered symptoms of COVID-19 since they first got sick. It's left them with thousands in medical bills.
I have one bill alone that is $15,000. Sometimes I have to go without my heart medicine. Sometimes I have to go without my nerve pain medicine. Sometimes I just have to take less than I'm supposed to, so I'm constantly living in agony.
Miranda had a specific issue of never testing positive for COVID on FDA-approved diagnostic tests, which made getting treatment difficult. Right now, Miranda is being followed for post-COVID-19 syndrome.
So I would go to the ER to get fluids, and they would turn me away often because I didn't test positive for COVID.
Roughly a year after she started experiencing symptoms, Miranda took a T-Detect COVID test, which physicians use to detect recent or prior infections based on T-cell immune response. The test was approved by the FDA in early March 2021, but Miranda had gotten the test prior to the approval. Her results showed she had a prior infection. Christina and Miranda both spoke about how it was difficult to access treatment because some of the doctors they dealt with dismissed their symptoms.
The ER labeled me with anxiety. I caught on and quit going to that ER and switched to a different ER. They were much more understanding and more thorough, and they had seen others like me, so I wasn't dismissed there. It was a more expensive ER. It's more like a VIP freestanding ER that you pay a whole lot of extra money to go to, and it's, out of network. But the hospitals covered under the insurance were awful.
Because of the complications of their condition, a lot of Miranda and Christina's treatment wasn't covered by their insurance.
The only thing I wish that insurance would pay for that they don't are some of these more in-depth tests that the functional and integrative doctors use. Long haulers are getting loads more information and real help through those type of tests, but insurance won't cover them, and they're expensive.
Christina and Miranda are both enrolled in a clinical trial that's testing a specific drug to treat post-COVID syndrome, and it's offering them some hope. But there are many expenses that come with being a part of the trial. They both must travel out of state in order to participate, which costs thousands of dollars between the transportation, lodging, and food they must pay for over the course of the 8 weeks the trial lasts. Even patients with cases that aren't as severe as Christina's and Miranda's can be left with thousands in medical bills. Joe Babian was hospitalized for COVID-19 for about a week, but he never had to be intubated. He attributes his quick rebound to having received an early dose of remdesivir when he first experienced symptoms. His insurance covered the treatment.
That remdesivir I received, being an emergency use authorization, I'm convinced it saved my life. It was $17,000 for that particular treatment alone.
While Joe doesn't consider himself a long hauler, he has experienced some lingering symptoms that have required aftercare.
The aftercare expenses have actually been just as significant as the expenses for inpatient care. That's the thing with COVID. It keeps on digging that financial hole. It's not just a hospital stay. There's prescriptions and follow-ups and more tests. And of course, that's from myriad different providers with all different billing policies.
The CARES Act, which passed in March 2020, mandated that insurance companies pay for FDA-approved COVID diagnostic tests. However, these government protections did not extend to coverage of coronavirus treatment, but there are some government resources for certain Americans who qualify. A program implemented by the CARES Act gives uninsured Americans the opportunity to have their treatment covered by the government.
When Congress passed the CARES Act, they created a fund, which is called the Provider Relief Fund. The Provider Relief Fund tried to give monies to hospitals and physicians when health spending was pretty low. Physicians and hospitals who do get money from the Provider Relief Fund are required to make sure that they're not billing uninsured people and covering those costs. Expenses can be billed to the Provider Relief Fund.
But not everyone can get access to the program, even if they technically qualify. The hospital where the patient was treated must have chosen to participate in the program. And even if the hospital did enroll in the federal program, the process of applying can be a heavy lift. The government requires a patient's bills to be coded in a certain way, meaning the hospital has to give a specific diagnosis that meets the government's standards in order for the patient to be covered. That means patients might have to go back and forth with the government and the hospital in order to satisfy these requirements. And when someone is sick enough to be hospitalized with COVID-19, they usually aren't up for the task of navigating that kind of bureaucracy. Reforming the U.S. healthcare system has been a political football for decades. But in December 2020, Congress passed a law called the No Surprises Act. The legislation requires insurance companies treat out-of-network services as if they were in-network when calculating how much a patient must pay out of pocket.
Congress is requiring that the hospital or physicians work with the insurance company directly and hold the patients harmless. So people will not get the surprise bills, and the insurance company and the hospital will have to negotiate outside what the appropriate payment amount is.
The law, however, doesn't take effect until 2022. The impact of COVID will likely linger in the healthcare system for years to come, which means Americans may be in this for the long haul.